Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
I'm thinking of having a facelift. Is there any point in having any non-surgical treatments such as Botox fillers or skin treatments?
You're thinking of having a facelift? That's a really good question. Should you be doing anything else before or afterwards? So why would you be having a facelift? Let's look at that first, because a facelift is a very good way of addressing facial laxity. So the surgeon is going to lift those tissues, tighten them and anchor them and replace them. And it can give a fantastic result that can last decades. However, it's a big operation. And not all facelifts are successful. So when are you not a good candidate for a facelift? And when would you consider other things? So obviously age is an important thing. Maybe you're not the right age group. It's not something you should be thinking about in your 20s or 30s or perhaps, but often most of our patients are going to be in their 50s and 60s when they're thinking of having a facelift. By then, there's probably been quite significant skin aging. There may be volume loss in the face, there may be bony changes to the facial skeleton, and there may be significant loss of collagen and elastin in the skin and seeing skin aging. All of those are going to affect the benefits of a facelift. Is the facelift going to last as long because there's significant skin aging with loss of collagen and elastin? Instead of lasting decades, it might only last a few years. Is there significant volume loss? Is there significant bone loss? All of those are going to affect how the outcome of a facelift, okay? Because that's going to really sort of affect the ability of the surgeon to give a nice natural looking result at the end of the day. What I tend to find is that most patients that are thinking about a facelift, it's a good idea to see if we can restore some of the collagen and elasticity back to the skin in the first place. I think there are plenty of treatments such as Gelena Sweden that we do, or Sunakos, where we can really improve the quality of the skin. And if you're going to have a facelift, if we can improve and reverse some of the aging of the skin, you're going to get a better result. It's going to look better. The surgeon's going to be happier because he's going to have better wound healing, etc. after the treatment. And yes, that's a great thing to do before and afterwards, because don't forget, when you've had a facelift, the skin continues to age. So you're going to lose the benefits of that facelift gradually because the skin itself is going to get laxer, more wrinkled. So all of that needs to be addressed. What I would probably avoid, if you're thinking you're definitely going to have a facelift, is doing more invasive treatments that could actually alter the nature of the tissues that the surgeon's going to lift, such as thread lifting or even fillers, hyaluronic acid fillers, because these are often placed where the surgeon is trying to separate the facial tissues and lift them. And those treatments we know can interact with the tissues over time and produce a lot of stiffening or scar tissue. And that makes life difficult for the surgeon. It even makes the facelift more challenging for the surgeon, more risky, because he's more likely to potentially damage the nerves or arteries because they're all stuck down with scar tissue. So most surgeons I know who are very good at facelifting really don't like doing facelifting on patients who've had a lot of threads or fillers in their face. But we can improve the skin quality, as I said, and that's definitely something you should consider doing, both before and after the facelift. The other treatment that I encourage patients to look at if they're going to have a surgical facelift is looking at the healing after the facelift. So there's a lot of healing after a facelift, a lot of swelling, a lot of inflammation, and obviously the scars. We have a technology in the clinic which is LED phototherapy. Now, this isn't your sort of little red mask treatment that you get out there for a bit of skin rejuvenation. No, this is a very powerful system for wound healing, and it delivers near infrared energy that you can't see very powerfully, very deep. That and a little bit of red light can significantly reduce the swelling, the pain, and improve and accelerate the healing following a facelift. And that means you're going to see less, you're going to get over that facelift more quickly, you're going to have less visible scarring over time. And so it's something I talk to all of my patients who are considering a facelift, is to come back to us as soon as after their facelift and have a weekly treatment with the Dermalux Triwave MD, because we see superb healing in that situation. And a lot of my surgical colleagues are actually investing in this technology as well, or directing patients to me to have this treatment. So that's something else I would consider.
Okay,